This video will talk about how to brush your teeth if you have braces on. So brushing your teeth while you have braces on, it shouldn't be more difficult than brushing your teeth without having braces on. So I think the important thing is you need to make sure you have the time and the patience to do it correctly. Yes, the braces will get in the way. You need to spend a little bit more time around each individual tooth, but there's no reason why you can't do a good job in a short amount of time. So keeping that in mind, I've got here a little model of a mouth with braces on. Got to remember that you have that little piece, the little square of ceramic around, or metal around your tooth, and that's where little bits of food and bacteria, dental plaque, will bind to or attach to. So you need to make sure that when you're brushing the tops, you're brushing the insides, but you're spending just a little bit more time around the little brackets. Okay, so you can use a normal toothbrush, just a plain simple toothbrush. We do suggest that you have one with soft bristles and a small head. So it's important to have a small head. That way it fits around the brackets in between your cheeks and the teeth just a tiny little bit better. But regardless of whether it's a manual or normal toothbrush or an electric toothbrush, it should be used the same way. Now, there is a specific head that you can buy for brushing teeth with braces for the electric toothbrush. It's a little bit smaller. This is one of them, interdental head, so it just fits around the teeth a little bit better. It's got a pointy end, and you can just use it to walk your way across or around each bracket. It's very important that you're cleaning around each of the little squares. Now, the reason why I keep getting back to this is because I've seen it plenty of times in the past when patients were not so good with their brushing, with their hygiene habits, and because you had so much dental plaque stuck around the little square for such a long period of time, it could be a few months, it could be a couple of years, when the time comes for you to have the braces removed, we find this little square mark on your tooth. So it's almost like scar tissue from a cavity that potentially started, never progressed into a full hole, but just enough to damage the tooth. And there's nothing that upsets me more than have a great finished result, teeth perfectly aligned, but then you see the teeth with these little marks. So it's very disappointing for all of us, me especially, and it's all due to poor hygiene. And in fact, we find these days, some of our patients who are really not brushing or not committed, I think we see that more around kids and teenagers. Sometimes we get to a point that we actually tell them they should consider stopping treatment because it can really have a big effect on the health of their teeth long term. So make sure you're brushing, make sure you're cleaning, and you're spending the time to brush around each tooth. So if you're using a normal toothbrush, it's no secret. I do suggest that you try and brush slowly in circles around each tooth. That way you can ensure that you're brushing around the little bracket. So if you brush the usual way, back and forth, sometimes you might miss underneath the bracket. So my suggestion for people with braces to brush in circles around each bracket. That way you're trying to get the bristles of your toothbrush to fit all around the little piece. So when you're brushing, of course, the tops of the teeth, no secret there, just the usual way. Same thing on the insides, in the way you want. But just make sure you're not forgetting any areas, and you're spending a little bit of time cleaning around the brackets. Very, very important. Now, there's a couple of different toothbrushes that you can buy, and I find that these are particularly helpful for people with small mouths, or if you're having trouble cleaning the very back of your mouth, if you're gagging, if you have a strong gag reflex or something like that. So these are what we call end tuft brushes, and what they are, they're little brushes that look like this. So they only have one tiny little tuft of bristles, and they're quite tiny, and you can actually use it to brush around each little piece. So that way you know for sure that you're getting around the bracket. So I find these brushes are particularly helpful when you need to clean the very back of your mouth and you can't see where you're going with the normal toothbrush. These brushes are also really, really good for patients who have wisdom teeth coming through and they need to reach underneath the gums or clean around the wisdom tooth. So you can clean the back of your very last teeth very well with these brushes. Some people also like using them to brush the back of the front teeth here. It just gives you a bit more access, a bit more visibility, so they're quite handy to have. I've seen now in the market a alternative version of the end of the brush. It's called the reverse focus from Erskine Dental, and it's got a sharper angle at the tip, so it's like a hook-shaped brush, and again it's made specifically to clean the back of your front teeth. I think it's quite handy. I've only seen it recently, maybe a handful of months, so it's called the reverse focus. Again, quite good to brush the back of your last tooth there. And these are places that often we find a lot of build up and people often miss, not because they don't know about it, it's just hard to get to with a normal toothbrush. So this is something I would certainly suggest you consider. Now, regardless of what toothbrush you're using, I think it's important to mention that you should also be using a good quality toothpaste. So we recommend that you use a toothpaste with fluoride at least twice a day. Some of our patients also get to use a mouthwash daily. It all depends on your risk of caries and how we assess your teeth every time you come in. Another product you might want to consider using is tooth mousse, which can help remineralize or strengthen, almost regenerate your teeth if used properly. It's a slow process, but again, I think that every little bit helps when you've got braces on and you want to make sure your teeth are as perfect as they can be when the braces are removed down the track. Now, we've got another video about flossing for braces, and I suggest you watch that one as well. Very interesting, a couple of little devices that you can use, and some of my tips for flossing your teeth properly with braces on. So click the like button if you find this video useful. Don't forget to comment and subscribe.